All right, everybody, the next session which we're going to be discussing is kind of an accumulation of the various sessions which we've had today. And the title is to improve and measure standards of care. And I think this is very important for us to discuss because it is actually a contentious issue. And in my discussions with Calvin, we've taken the approach of structuring it so that we understand what the challenge is, or should we say what the problem is, and then what the solution is. And, well, the most important thing to speak about is how are we going to come to a solution. So, Calvin, maybe you can just elaborate a little bit more on the challenge which we have with regards to the grading of care in our facilities.
Absolutely. Thank you, Stephen. Thanks for the opportunity. It's been a great day. We've heard a lot of content from a lot of speakers around the world. And I think it culminates in the conversation around when the consumer or the customer, which in a lot of the cases it's the family member of the residents that will come into care, has to have that daunting conversation with the family and that daunting task of where do I put my loved one that they can get the best possible quality care. What we are seeing specifically in South Africa is that because there is no sort of grading or process that allows the customer to be informed, what we are finding is that the people with the best websites, with the fancy names, with the best billboard, are the ones that are getting the attention. Our concern is that the quality of care is not always linked to the face or the facade of the organization, especially in an environment where we have a mix of organizations working in as not-for-profit spaces to put as much back into the facilities, and then we have the private sector facilities that are for-profit businesses. And unfortunately, they're not working in parallel. So our challenge is how do we make sure that the customer, being our resident, and their decision makers, often in the case of dementia care, the family members or the loved ones, how do they decide where is the best case? And as we heard testimony from John this morning, was that he had heard about Primvilla. He had a conversation with Sister Anne, and that's when he knew in his heart that was the right place for his family member. So the conversation we're going to have is, that's the challenge. How do we support the sector to become self-regulating so that they can put something in place so that their customers are better informed, better equipped, and we almost self-govern ourselves as far as the quality of care. John gave a wonderful presentation of the Australian market. No criticism to the powers that be, but I don't think we're in that space yet in South Africa. And private sector, the non-profit sector, and government need to work together to get to that Australian model. But that's not going to happen overnight. So I think it's about how we support the sector and empower them to be able to find the solution together.
So the solution, in effect, is transparency and measurability, and ultimately an informed consumer.
Absolutely. And it's, as I said, it's not only about the bells and whistles. You can have the best possible quality care and person-centered care in a facility that the facade, you think, this is not a great facility, it's not the great best area. It's probably one of the cheaper facilities. And on the opposite spectrum, we've got very expensive facilities that profess to be giving person-centered care and world-class standards. But when you walk through the doors, do the staff have the right equipment? Exactly what all of our speakers have been speaking about today. Are the care partners best equipped? Are we focused on person-centered care? As we heard about the helicopter trip, do we understand the customer? So when, I always have a saying, it's not about the number of meals you serve and the number of times you change the linen, it's about the experience for that resident every single day. And we as family members, it's very easy to walk in and walk out. We're not living in that facility, especially in the care centres. Those residents are, but stuck there. And especially the ones that are immobile are stuck in that bed 24/7. So how do we make sure the best possible equipment, training, person-centered care and support is in place to ensure that that resident has the best possible care at the available price point? The challenge for the consumer is when you've got a choice of 25 facilities to choose from, how do you make that decision? And something like a grading where the industry themselves can say, let's put up our hands and say, if we tick box 1, 2, and 3, we get a 3-star. If we tick box 1, 2, 3, and 4, we get 4 stars. That will help the consumer also know where they position themselves. And I think it'll also help the facilities and the organizations and the service providers that are selling to the customer to be able to say, if you can afford a 2-star, this is what you're going to get. If you've got the money for 5-star, that's what you're going to get. But I reiterate, it's not about the facade, the curtains, the drapings. It's about that quality care and equipment to ensure that the resident is cared for. And the care partners are not strained, because if we have care partners that are under strain and stress, that's when you have accidents, you have skin flaps, you have falls, you have all these issues. So it's an interesting conversation. I think it's going to be a tough conversation to get this right. But I'm very, very privileged and proud that Arjo has put up its hand to say, let's start having the conversation on this platform to get the industry to come together to say, how can we work as an industry to better our industry for our customers and our residents?
Wow, it's a lot to take in. I had a conversation with an organization called CASASA. Now, CASASA is a health accreditation company, and it was a very interesting conversation because up till now, there have been no accreditations of long-term care facilities, except for one. And I asked some questions about what did the accreditation process look like? How was it done? And it was very comprehensive, but it was very theoretical, risk management orientated. So for me, if I were to look at what contributes quality care and how do we measure it, and Henny mentioned earlier about not being able to manage what you don't measure.
Absolutely.
So, if I were to look at the 24-hour picture which we've had of all the moves and the handles and bath time, toileting time, I would say we need to break it up into measurable sections. So we say, what does your in-bed care comprise of? Do you have a fixed type bed that should be in a museum, or do you have an easily adjustable electric bed, for example? What type of surface is on the bed? Is it inherited from a hospital, or is it a mattress which is going to give clinical benefit to the skin? How do you do your in-bed repositioning? Are you using friction-free sheets to manage the unseen destructive forces of friction and shear? This would be one area where we can measure in-bed care. Then we would have to address safe moving and handling.
Absolutely.
Number one, do you have the gear to be able to safely move Albert, Barbara, Carl, Doris, and Emma? Very good. Do you have a policy to get the water into the horse? Do you have the training to make sure that all your caregivers are proficient and skilled so that the consistency of care is there? And then, of course, we've got the big area of dementia care. What does your dementia approach look like? Is it person-centered that your caregivers have got the skill? You're putting emphasis on recreational therapy and multisensory stimulation? And are you encouraging calmness? Or does your approach to dementia result in more pills when the going gets tough?
Yeah.
Because that for me is not best practice and it's not person-centered. I think the area of seating is also something that needs to be spoken about. Because, in South Africa, if we look at a specialized seating device, we see a lazy boy. A lazy boy is not supposed to be in a healthcare facility for a number of reasons.
Absolutely.
There's no access underneath. It's not very infection control friendly. It's not appropriate. So do you have specialized seating devices which are going to result in the optimum positioning and functionality of my mom or dad? And if you do, then maybe get another tick in another box.
Absolutely.
So, it's a difficult one, but I think we've got a general direction that we want to go.
Yeah.
And of course, is my mom or dad going to be washed in bed? No. In fact, we're very proud of the fact that we've got all of the equipment to enable one-to-one interactions in the shower or the bath, allowing it to be a quality experience, not an experience of indignity and discomfort and embarrassment. So I think the topic is starting to move. I'm hoping that the discussion is getting people thinking out the box with regards to what can we do differently to make it more about the resident.
And I think that it goes back to the topic of today, which is the power of movement. And everything we've discussed throughout the day, it's been a build-up and a build-up and a build-up to this conversation about the power of movement and ensuring that whenever that patient or resident is moved, in whatever way, shape, or form, it is done as safely, as risk-free as possible. I had horrid memories of families being very upset when they saw skin flaps or bruises, or when a resident fell and broke a hip in the facility. And that's a tough one to have to pick up the phone and have that conversation with the family. And the first thing the family says is, how did this happen? This is a care facility. So built on everything you're saying, that the facility needs to take a step back and take a critical look at itself and say, what are our risks? What are our fall risks? What are our movement risks? And how can we mitigate those risks? And the beauty is that throughout the presentations this morning and the conversations with the folk that have been here on stage with you, the solutions are there, ladies and gentlemen. Yes, it's not a cheap solution. Yes, we don't all have a magic wand and an open checkbook, but it's about starting small, and it's about starting piecemeal, and it's about just changing the mindset of the care partner to say, let's do everything in our power to ensure that our residents have got a safe space, have got and our care partners have got all the necessary equipment to ensure that our residents' risk of fall and injury is reduced. And as we've shown and demonstrated throughout this morning, today, on the power of movement, is the power of movement is important. But if we're going to run this race, we better be ready. We better be equipped. We better be trained. We better be efficient. We better be effective. And I think this is the conversation of how do we get the sector and how do we get folks that are attending this virtual conference to put up their hand and say, I'm going to be a leader. I'm going to put up my hand and say, I am going to put myself out there as a facility to say, we want to be part of a movement that is going to improve the quality of care and person-centered care through something like a self-regulatory grading system or tick box system. We don't know yet. So I think it's definitely something to have the conversation about and encourage the folks to get hold of us and start the process.
Well, you mentioned that we've got a poll which we're going to be running now.
Yep.
It should come up onto the screen. And we're going to invite you to actively partake in the poll so that we can get some feedback with regards to your opinions of whether such a grading scale should be implemented in South Africa.
Yep.
We also want to know how you would rank yourselves. So if we can have the poll questions up, please, guys.
There we go. So we have 3 poll questions. If we can ask the folks to participate in the poll, it gives us an idea so we can see. We do know because of technical, there's a slight delay, so we may be a little bit behind you in studio or ahead of you. But these are the challenges of the world we live in today. Right, so the first question.
Do you see that from
Yep.
Kelvin?
Is there a need for regulating standards in care in South Africa? Do you agree or disagree? So if we can ask the folks on the webinar to just click whether they agree or disagree. And a lot of people so far are saying absolutely, we agree 100%. So thank you very much for that. We're going to go to poll question number 2. We're going to ask our wonderful technical team in the back. So question number 1 was, do you think we should have a grading system? Everyone agreed 100%. We're going to go to question 2. And this is also quite an easy one. Okay. So our question 2 is, if there was a scale of 1 to 4, 1 being low and 4 being the highest, on the quality of person-centered care in South Africa, how would your facility rate? I'll repeat the question. If there was a scale of 1 to 4, 1 being the lowest, 4 being the highest, on the quality of person-centered care in South Africa, how would your facility rate? So how would you rate yourself? And looking at the bar charts, no 1s, lots of 2s, lots of 3s, 1 4. So most you're saying 2, more you're saying 3. So that's positive that you're grading yourself as moderately high in person-centered care. All right, so we can go to the last poll, please, technical guys. And our last question is, would you partake in a self-regulating care standards initiative in South Africa? Would you participate in a self-regulating care standards initiative in South Africa? Yes or no? So now we're putting you on the spot and saying, are you willing to put up that hand and say, we're part of this movement in changing quality of person-centered care in South Africa? And we're just waiting for results. All yes? Okay, a majority of folks on the call said yes. So Steve, that gives us a really good indication of what the public are saying and the participants, that they agree with us. They think that we're having the right conversation and that this is definitely something that needs to happen. So what is our next step? How do we make this power of movement become a reality for folk that are on this webinar?
Calvin, it's a good question. I think the answer is that the consumers are going to become more informed. I think the more we talk about it, the more momentum it's going to gain. I think the fact that we started talking about it is a beginning point.
Absolutely.
And please, people, reach out to Arjo to help you with your care quality improvement plans. It's been mentioned a number of times today. So we do consider ourselves more than just a supplier. In fact, we would proudly say that we're a mobility outcomes partner. And this is the first step of many.
Absolutely.
I think we do have a long way to go in South Africa. I believe our base is relatively low at the moment. But remembering that the acute sector, hospitals, was in this space 20 years ago.
Absolutely.
Okay. And I'm very proud to say that Arjo Huntley was instrumental in bringing about the improvement in the hospital sector with regards to electrifying the beds, for example. You go into most private hospitals, you get an electric bed. If we look at the state, they've just put electric beds onto the national tender.
Fantastic.
And we're very proud that we'll be supplying those. So,
and sorry, Steve, the irony there is that residents or patients in hospitals are short-term stays. Here we're talking about residents that are in care facilities for many, many, many years of their life sometimes. So why shouldn't we be having the conversation about the same quality and even better? So I think that you're absolutely right, that we've got to follow what the private sector as far as acute has learned and follow suit to provide that quality of care, if not better quality of care, 365.
Very, very valid point. And most people in aged care facilities are not sick. They just have health and mobility related challenges.
Absolutely, yeah.
So yeah, a great session.
Thank you.
A good discussion.
Look forward to the next one.